Om Shanti. All of you, you can hear me? I'm visible?
Yes, you are.
So let's start the session with the one time with the little prayer. Come into the sitting posture. Keep your back, neck straight, align, relax, and gently close your eyes. Take a deep, prolonged, slow inhalation, deep, prolonged, slow exhalation. Now, inhale for the Om. Take a deep breath. Om. Shanti, Shanti, Shanti. Feel the vibration and sensation. Join your both palms. Grab your palm. Place on your eyes. Feel the warmness. Very slowly while blinking, looking at your palm, gently open up your eyes with a great smile. Om Shanti to all. So in previous session, we discussed about food according to the position of the sun and according to the Tridosha. I think till here everything is clear. Today we're gonna start the therapy for the problems. So we're gonna learn about it, how when certain problems come, certain diseases affected to your body, you are suffering, you are having the pain, how we can so general idea we're gonna talk about. Though you cannot be a yoga, even the diet, the whole mitahar, routine and everything. I hope it's very much clear to you guys, so you can at least help your students. No matter you're working as a yoga instructor, but at least you get the general idea about it, how you can change their day-to-day routine, and it could help no matter what kind of problem they are going through. So just by bringing the small change in their diet, bringing the the meditation, you can help provide the individual, therapist work. The approach should be individual, right? It should not be a general. So yes, they require if they're looking for the proper treatment, yes, they have to contact to the Ayurvedic doctor and yoga therapist. Okay, but you are not capable of doing those things. So keep this thing in your mind. You would not be a doctor. You would not be a yoga therapist. And I'll give you few tips how you're gonna still help your student. Okay, general idea is about. So one by one, we go through the problems, and according that, we're gonna take the help of the yoga and the Ayurveda and providing the treatment. Before introducing the yoga therapy, let's start understanding about a little bit history of the yoga. Just little bit introduction about the point is this the
Ma'am, your voice is breaking.
and he did this thing. The one French around 17 part of you and patient. He now I'm audible. Everybody can hear me.
Yes, yes.
So yes, we were talking about the coinage of the yoga therapy, which happened in the France. So originated in the France by Dr. Auriel, Bernard Auriel, and he introduced this, he coined this word yoga therapy, and first time he used the meditation part of the yoga and introduced to his patient, and he finds out that this the meditation is very helpful for treating the psychosomatic problems. And then after that, the yoga therapy, become very much popular in European countries. Okay, but you know that health and everything is byproduct. If you're practicing the yoga, you will get. So our yogis doesn't, give any word to these things. Even by practicing the hut yoga, you get out, you cure yourself with many diseases. Okay, so in yoga therapy, basically, what things we include. So quickly write it down. We have to, focus on the lifestyle of the patient, then his diet and how he reacts with the other people, his relation with the other, his family, and his, husband and wife and children. We have to observe these things. His physical activity, what kind of occupation he's in. We have to also consider that what kind of activity, what kind of occupation, what kind of work he's into it. Then his emotional and spiritual health also we consider. I Because sometimes many, especially the patient who is having the split personality disorder, something related to the mental disorder. It's basically they are come from the religious, religious things. They're more religious. So we have to even understand this thing. Basically understanding their mind, how actually their mind is working, and by observing these things, then we prescribe the therapy to them accordingly. So then later on, yoga therapy have the three perspective. Okay, three perspective. I'll write it down for you. Three perspective. One is Shakti Karma. Chikitsa. Then Adhyatma Karma. Chikitsa Karma, Shakti Karma, Chikitsa Karma, and Adhyatma Karma. So karma you can add later on. Shakti, karma, chikitsa, adhyatma karma. These are the three perspectives. Basically, yoga therapy is used for these things. That's the meaning. So write it down. Once you did, let me know, so I'll explain. Done? Everybody's written down?
Yes.
Okay. So first, that is Shakti Karma. So basically, people understand that yoga therapy only used for, when somebody got sick or something happened to his mind or his body. No, we have three perspectives here. Uh, to improving your strength, Shakti means strength. Improving your muscular power, your skeleton power, or even taking the precaution, right? So Shakti Karma, you are doing it. You're following which part of the yoga therapy? Shakti Karma. You can use the yoga therapy for improving yourself, improving your health. See, right now, maybe you don't have any problem, but you want to improve your physical appearance, you want to improve your mobility, you want to improve your flexibility, you can use the yoga therapy. Okay. Then second, chikitsa. Chikitsa means as a treatment, as a precaution. To raksha karna, to save yourself, to prevent from many diseases and to cure yourself. This is the two perspective of yoga therapy. Okay. So also you can use the yoga therapy for doing the chikitsa. Okay. Then third is adhyatma karma, which means for even spiritually, if you're finding out anything, a spiritual growth you want to go in that level in spirituality, that's also you require the yoga therapy. You can use the yoga therapy, adhyatma, to go into the adhyatma mark, the path of the spirit. You can go into that. So these are the three perspectives one should know. And before that, and what we're gonna cover in the yoga therapy, how we're gonna provide the treatment, and how we're gonna understand this, their lifestyle, their diet, their relationship, their physical activity, their emotional and spiritual health. These things we have to understand, and then is a deeper level of the practice. A yoga therapist should know all the things in the detail of the patient. Is like close, intimacy. It's not like a doctor kind of doctor and patient relationship. Like you go to the doctor, you sit for the 5 minutes and you just doctor resume and give you the prescription. It is not that kind of relationship. Hello, my voice is coming.
Yes, ma'am.
Yes, yes, you are.
So कहाँ तक सुन लिया?
Adhyatma.
𝐷𝐵𝐴. Okay. So even for the spirituality, you can use the yoga therapy, and you have to consider all the level of the patient, all the aspect you have to know. His physical, his mental health, his physical health, his social health, his every spiritual health, and everything about the patient you should know about it. So it's very close foundation you're gonna maintain with your patient. That's the way therapist approach towards the patient. If there is any problem, yoga therapy means remove the problems from the root. Okay, that's the approach of the yoga therapist. Or something. Why the problems come to that patient? It required deeper understanding. What kind of he go through is his whole life. So since childhood till now, whatever he did in his life, how he react, everything, every aspect of the life, we're gonna observe. So being a yoga therapist, I do these things personally. But yes, generally, the treatment would be different. Okay. So this should be you should get the idea about it. How we're gonna approach the treatment. I'm giving you the general idea about it. Individual, the treatment would be different. Okay. But I'll give you the tips, certain tips which you can use to help your student and your family and yourself also. Clear?
Yes.
Okay, good. Now, till here, everything is clear, how history of the yoga therapist and everything, right? Now we move to the problems. One by one, we're gonna talk about the problems. So there's a many diseases, many diseases. So few diseases we're gonna cover, and we're gonna look for the treatment. So first we're gonna take the problems of the Vata related problems. So I think arthritis, we're gonna talk about it. Write it down, the arthritis. I'll show you some, what is. I have shared you one picture. Everybody can see?
Yes.
Okay. So this is basically your knee joint. If you see in that, so knee joint, this is a structure anatomy of the knee joint. You can see one side there is a healthy femur bone, healthy articular cartilage, and healthy tibia bone, right? And one side is a degenerated structure of the knee joint. Can you see clearly?
Yes, ma'am.
Okay, good.
Yes.
So arthritis, I hope you heard about it. Arthritis, this name is very much popular, and it's very common disease, right? The common disease, we're going to talk about it and understand arthritis come with the age also. You cannot prevent the arthritis. Okay, so there's 100 types of the arthritis. There's more than 100 types of the arthritis. But few, yes, we're gonna talk about the few types of one or two maybe arthritis. What happened? First, we're gonna understand the problem, and then I'll give you the treatment, general treatment. So what happened to in arthritis? Arthritis means arthritis. It means inflammation, some kind of inflammation. Arth is means bones. Okay. So in your bones, especially your joints, gonna affected by inflamed or maybe infected by some kind of bacteria, some outsider invader come into your body and then they attack your joint. There's a certain, bacteria and by the virus who basically attack your joints. Okay, this is the one kind of then there is a autoimmune arthritis. If if you want to write it down, you please write it down. So autoimmune based arthritis called rheumatoid arthritis. Rheumatoid arthritis. Okay. Rheumatoid arthritis and common types of arthritis osteoarthritis. Osteoarthritis.
Ma'am, not able to hear
So this
you.
is the three types of the arthritis.
Ma'am,
Not able to
explain
hear me.
from autoimmune arthritis.
This is the problem with everybody, or only you are facing?
Yes, I was also not able to hear.
Same here. Yeah, you were cut sometime, like the voice is breaking.
Let me change my network. Let me change. Wait. अभी आ रहा है आवाज?
Yes.
Yes.
अब
Not able to hear you.
हेलो, अभी आवाज क्लियर है?
Yes, ma'am.
Yes.
Yes.
So, कहाँ पर थे हम? Anybody can repeat little bit?
You
Autoimmune
shared
disease.
autoimmune arthritis. You were talking about that, then we lost you.
Oh, autoimmune arthritis. So, yeah, three types of the arthritis we're gonna talk about it. One is osteoarthritis, one is infected arthritis, and then autoimmune based arthritis that called rheumatoid arthritis. Okay, these are the three. There's more than 100 types of the arthritis, but we're not gonna talk about rest of the arthritis. first, what happened? As I shared you the picture, you have seen that one joint is healthy, one joint is degenerated, right? And there is a, you know, and I'll show you another picture which give you the little bit more clarity. This side is okay. Yeah. So in this picture, you can see what happened to your knee. What happened when there's a arthritis? The inflammation happened in your joints. So these called synovial joints. Basically, no matter what happened, either it's bacteria or virus attack to your joints, or you are autoimmune. Autoimmune means in one arthritis, there's a virus and the bacteria invade in your body and they attack your joints, synovial joints. Synovial joint means all the joints which is movable, your wrist, your fingers, your elbow, your shoulder, ball and socket joint, then your pivot joint, your neck joint, then your knee joint, your hip joint. It has the name, okay? Ellipsoid joint, these are the name, okay? So just understand these called synovial joints. And what happened in this joint, virus attacked, and then you get the inflammation. Even inflammation happen when you get the mosquito bite, no? When mosquito bites you, you see the redness and everything. Basically, what happened, if you understand this thing, there is a WBC. Have you heard about it? White blood cell. The white blood cell means the white blood cell does what? It does the fighting. It is a kind of warrior, like a soldier in your body. Whoever attacks you, they're gonna fight with those things. Either it's a virus attack, it is basically your immune system. And every bacteria, every virus which invade from the outside or inside, something happened wrong. This is the duty. This is the dharma or duty of the white blood cells. They fight. They are the soldier of the body, protect your body from the different invasion. Okay, जैसे soldier लड़ते, how the soldier are fighting and we are resting, or rest of the organs are doing chill pill, doing the party, and doing daily everything. Same like how we doing the party, we are not included in the war, because daily W white blood cells fights many bacteria, many virus. It's happening daily. And how many times it's fighting, you don't know. Even it happened when mosquito bite. You see the redness, itching. This is the reaction when white blood cells fighting with the mosquito bite, and then get the inflammation in your skin. Same thing happen in your joint. When virus and any bacteria attack in your joint, this white blood cells gonna go there, body give the message to them, okay, immediately there is emergency, somebody is invading in our body. So you have to protect. They go in the emergency on their bike, they reach to that particular area and they fight, and then you get the inflammation. Okay, so that called infected arthritis. It happen, it depend, person to person, which bacteria is affected by, which virus is affected by that person. It's not like forever. It can be, little bit controlled by the allopathic treatment and the ayurvedic treatment also. Once bacteria is gone, the virus again, our white blood cells gonna relax, and then there is no further inflammation. Okay, but this not gonna happen with the osteoarthritis. Osteoarthritis happen because of the age. So when you enter into the old age after 35 and 40. And because reason could be many, as I tell you, when you reach maturing, entering into the old age, your vata gonna increase and your bones gonna affected. Remember we talked about when we did the vata prakriti,
Yes.
right?
Yes.
So
Yes.
so vata is increased in your body during that time, and then your degeneration started happening. So bones gonna become weak. Your bones also having the age, right? All of you aware about it. Each part of your body have the age. There's a limitation of your body. In natural, that's what happened. Degeneration of the bones start happening, and regeneration of the bones not happening much. And then slowly, gradually, you die naturally, and you get the infection or other because you you have the weakened bones, weakened muscles, weakened skin, weakened immune system, and then you get the disease, and then you die. The natural death. So gradually, slowly, this you cannot avoid only through certain yoga practice, and if you are into the yoga or other meditation, then you can prolong, you can prolong your young age. That's you can do, and you can delay your old age. And yes, there's many yogi who reverse this cycle also. But there is a great yogi. They never go, they never attain the old age. That's also happened, but that is a higher stage of the yoga, in the yoga, a very higher stage. So, but at least by doing the simple practice, you can make your joints healthy. So it's happened. Your bones gonna degrade slowly, gradually, and then the picture which I have shown you, shared you, you have seen that one, there's a cartilage inflected. So in osteoarthritis, there's a layer of on the tibia and your fibula bone. Can you see? There's a one layer which called cartilage. Cartilage means it means basically cushion, kind of cushion, provide the cushion to your bone. That gonna infected in your osteoarthritis. That gonna weaken because of your age, because of your poor lifestyle, poor diet, or lack of the immobility, drinking alcohol or drugs, or laziness, sleep apnea, insomnia, stress, anxiety, too much workload, wrong posture. Reason could be many. There's no fixed reason. Okay. So it's gonna affect your bones health. It's gonna affect your cartilage. And when you walk, they're gonna inflame. When you walk, it creates the friction. Are you know? Are you aware about the cushion? When you use the cushion, you get the little bit support. You don't feel little bit friction, right? So same thing happen when two bones are joined together. There is a cushion between the two bones. So when you move, no, when you move your hand, you're walking, you're running. So there is a cushion between the two bones, which avoiding the friction. So cushion soak, that cartilage soak the friction. This is the purpose of the cartilage. But when it's tear apart, it weaken, it's become thin. The reason, these are the reason. Then you feel the pain, numbness, tingling. This is the symptoms. Pain, numbness in your joint. Also, you don't feel itching, tingling, and also this also affected your itching. Sometimes you feel, then limitation of the range of the motion would be limited, and deformities like टेढ़े मेढ़े हो जाएंगे, deform heart, like your joints become deformed. I don't know, have you ever met with the 𝐂𝐤𝐬 situation, 𝐂𝐤𝐬 patient who got the arthritis? Their fingers become, crooked type of thing, and their knee joints टेढ़े-मेढ़े हो जाते हैं. So these kind of things happen. Stiffness in the joints, they feel, okay? So these problems, these symptoms they face. So another type of arthritis, that is a rheumatoid arthritis. Now this is a joint inflammation, and this happens not because of age, not because of any virus and the bacteria. Your body, it's the autoimmune disease. Autoimmune disease means, have you heard about it? Autoimmune disease. Anybody? Anybody has any idea about it?
No, ma'am.
No.
Okay. So autoimmune disease basically like cancer. This is autoimmune disease, arthritis, rheumatoid arthritis basically. Then vitiligo, white patches disease. These are the autoimmune disease. What happened? Your immune system, white, white blood cells, WBC, white blood cells, they get the wrong information. Like soldier get the wrong information that somebody is attacked in that area, and they rush towards it. Blank call nahi aa jata kabhi kabhi on the, like, oh, what gonna happen, and soldiers just get to, they ready and they start doing the fighting and everything. So same thing happen in your body. They get the wrong information, wrong idea about it. Somebody invaded in your body and they are attacking your joints. And because of that wrong understanding of the cells, and they go in order to protect, and they create the antibody. They create the antibody, and then it's gonna inflame the joint. So basically, the inflammation happen now on the outside. Have you seen there is a synovial membrane, the picture I've shown you? There is a fibrous, joint. Fibrous means there's a ligaments. When your knee are joined together, there's a, fibrous, there's so many ligaments attached with, ligaments are more like a wrap, like a ribbon. When you tie two things together, you have to bind, no, with the rope. Same thing happen in your joints. There's a rope kind of things which wrap around these joints, in your knee joints, in your elbow, your wrist, everywhere. Whenever there's a two joints are meeting, there's a ligament, fibrous joint, there's a synovial fluid. Synovial fluid is like water kind of structure, and then those things would be inflamed because they create the antibody. Antibody is like for giving the protection, but there's no virus, there's nothing going on, just because they get the wrong inception and they start attacking their own body. Your body start having the inflammation because of that reaction. The fire to chal raha hai na, soldier are using the guns, so it's gonna hit somewhere, it's gonna hit where, it's gonna hit in the joint, they're firing, so it's gonna hit in their joint, in their ligaments, in their synovial membranes, synovial joints, cavity. These area would be affected, and then there's inflammation, and there's lack of the mobility. When there's inflammation, so what happened? You cannot move, lack of the motion, mobility. So क्या हुआ? Outside structure becomes stiff. When there's inflammation, that structure becomes stiff, and then you cannot move. When you move, you feel tremendous pain. So this happen, and this is incurable. There's no cure. For rheumatoid arthritis and osteoarthritis, there's no cure. Okay, and the one arthritis which come with the age, and rheumatoid arthritis, it can happen to anybody. It can happen to the child even. It depends, person to person. But we can provide the treatment on the symptom basis. we have, we can suppress the symptoms. That we can do about it. So early symptoms, you have to figure out how you're going to figure out. In early symptoms, like when you wake up in the morning, so like in arthritis, what happened? Your joints become stiff. And rheumatoid arthritis, so what happened? The structure becomes stiff outside this area. Like I tie the wrap around it, so like my knee having the wrap, and I tight, very tight. So what happened? The motion would not be happening, right? So this I cannot move further when I tie very much tightly around it. So rheumatoid arthritis, what happened? The structure becomes stiff because of the inflammation, because of the attack of the white blood cells in order to protection, but because of the wrong information, yes, they get the wrong information and they get panic, and then they are fighting, they're using the gun, but there's no, enemy. So that's how everything is happened. So the tiring and this range of the motion is limited. So this happened in the rheumatoid arthritis. What happened in early stage? If you feel, stiffness and pain in any joint, little bit pain, like I cannot move my shoulder, or it started very early with the finger, you feel stiffness in your finger, and when you wake up and you cannot, move at least 1 hour, after more than 1 hour, it remains stiffness in your finger, in your shoulder, in any area of the joint. It it is the early symptom. It means there is a high chance. It's not like you get the arthritis. It could be, it can be, okay, it might be. So you have to go through the test. So they can count your, blood cells, complete blood cells counting, because they're gonna figure out maybe your body is not producing the antibody or something, and they're gonna find out there is no virus attack or something. These kind of tests they're gonna go for it. So, and this rheumatoid arthritis later on can affect your even chest. When you take the deep breath, when the arthritis is aggravated, it affects your eyes, it can affect your lungs. You deep inhale and then you feel the pain in your chest. So that is also, you can figure out, might you get the arthritis. So you have to go through the checkup. You cannot just take for granted. Okay, these things you have to do. So I hope you understand this whole bone related, and this happened because of the Vata imbalance. Okay, this basically happened when Vata is imbalanced. So this much is clear. So all the bone related problems happen because of the Vata imbalance. So osteoporosis, osteoarthritis, osteomalacia. Malacia is like lack of the blood towards your bones. Okay, uh, and then there's arthritis, rheumatoid arthritis, infected arthritis, everything bone related problem because of the war. So we have to in the war. But I hope you understand this thing right now. Tomorrow we're going to talk about the treatment and how we can help them, these people. And this is a very common problem. Most of the people, especially the female, get more diseases now, and because it happened because of the hormonal imbalance also, menopause also, and even your stress also can trigger the arthritis. Okay, so reason, there's a thousands of the reasons which can trigger the arthritis syndrome. So once you get a lifetime, you have to take there's a long term treatment. It's not like, okay, the by just taking the pills you would be cured. No, it's not gonna happen. So you have to take lots of precaution, lots of uh, control, moderation on your diet, and then yes, asana practice, and yes, more breathing. and meditation help you to come out this problem. Tomorrow we're gonna talk about it, but I hope you understand this problem.
Yes.
And everybody is understood this thing?
Yes.
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 Thank you.
Love. Wonderful. So tomorrow we're gonna talk about the treatment of related to these issues. Basically, I'll cover all the bones related treatments, general treatment, which you can, no matter what is their problem related to the joints or the bones, you can at least guide them. You can guide your students. Okay. So tomorrow we're gonna talk about it. So Om Shanti, Mangal Ho, bless you guys. Meet you at meditation class. Be there.
Thank you.
Blessings to you.
Om Shanti.
Bye-bye.
Thank you.
Om Shanti, thank you very much.
Mangal Ho.